Hello and welcome to my channel. Chronic joint pains caused by arthritis affect millions of people across the world every year. There are different types of arthritis, but in this video we will discuss the most common form of arthritis known as rheumatoid arthritis. We will talk about what is rheumatoid arthritis, what are the signs and symptoms you develop if you have rheumatoid arthritis, and its homeopathic mode of treatment. Hi, I am Dr. Sana, homeopathic consultant and physician, and let's begin. Rheumatoid arthritis is the most common form of autoimmune arthritis. This disease most often begins between the ages of 30 and 50 years. However, rheumatoid arthritis can start at any age. RA is an autoimmune disease. Autoimmune disorders include diseases like systemic lupus, multiple sclerosis, psoriasis, etc. In this type of diseases, the body's own immune system attacks its own cells mistakenly and damages them. That is called autoimmune disorder. In rheumatoid arthritis, the body's immune system attacks the membranes that cover our joints. These are known as synovial membranes. Your immune system is supposed to attack foreign substances in your body like bacteria and viruses by creating inflammation. In an autoimmune disease, the immune system mistakenly sends inflammation to your own healthy tissue. The immune system creates a lot of inflammation that is sent to your joints, causing joint pain and swelling. If the inflammation remains present for a long period of time, it can cause damage to the joint. The cause of rheumatoid arthritis is clearly not known. There is evidence that autoimmune conditions run in families. Like if there is a family history of rheumatoid arthritis, then there are chances of getting affected with rheumatoid arthritis more. Rheumatoid arthritis affects the joints in your hands, wrists, knees, elbows, shoulders, and ankles. The joints affected are usually symmetrical, meaning it affects the same joints on both sides of the body. This is an important factor that clinicians use to differentiate rheumatoid arthritis from osteoarthritis, which is another common type of arthritis. But the joint pains in osteoarthritis are usually asymmetrical. Rheumatoid arthritis symptoms are different for each person. Some people have long periods of remission with few or no symptoms. Other develop severe pain and stiffness episodes that can last from a few weeks to many months. Rheumatoid arthritis usually affects the hands and feet first, but it can occur in any joint. It usually involves the same joints on both sides of the body. Common symptoms include stiff joints, especially upon getting up in the mornings or after sitting down for a while or after prolonged activity. Increased stiffness early in the morning is often a prominent feature of the disease and typically lasts for more than an hour. Gentle movements can relieve the pain in early stages of the disease. Your affected joints also become tender, meaning there is pain when you press your joints. The joints may feel warmer and have color changes related to inflammation, like they may appear as reddish. Rheumatoid arthritis can also cause generalized symptoms like fatigue, muscle pains, poor appetite, a depressed mood. As rheumatoid arthritis, apart from the joints, affect different parts of the body. If the rheumatoid arthritis affects the skin, it may develop rheumatoid nodules. These are bumps under the skin. Most of the time, they are not painful and they move easily when you touch them. About 1 in 4 people with RA get these skin bumps. They usually develop on your elbows, but they might show up on your other bony areas like underside of your forearm, your Achilles tendon, or the tendons in your hand. So these are the some of signs and symptoms you could develop if you have rheumatoid arthritis. Your physician may order some lab tests to confirm the diagnosis of rheumatoid arthritis. These include the erythrocyte sedimentation rate ESR and C-reactive protein, that is CRP. Higher levels of ESR indicate inflammation of joints and in the body. Other tests are ANA or anti-nuclear antibody test and anti-CCP. An X-ray or MRI of a joint can help to identify what type of arthritis is present. X-ray can show much joint damage you have, and MRI can give you a more detailed picture of your joints. Now let's move to the homeopathic mode of treatment for rheumatoid arthritis. Homeopathy shows remarkable results in mild to moderate cases of rheumatoid arthritis. Homeopathy medicines for rheumatoid arthritis help manage pain and stiffness in the body, but the deformities cannot be reversed. These medicines are of natural origin, thus are safe to use among people of all age groups. So the commonly used medicines are, the first choice of medicine is Rustox. Rustox helps to relieve joint pains and stiffness by reducing the joint inflammation. Patients complain of stiffness joint in the early morning, which are aggravated in the morning time and also after a period of inactivity, and it is relieved by warm application and motion of affected joints. This medicine can be taken in 30 potency daily early morning one time. The second drug is Apis mellifica. This helps in reducing the swelling in the joints, and it is well indicated medicine for cases where joint is highly swollen. Along with this, the joint is red and inflamed. Joint pains are mainly burning, stinging type, are treated by Apis. Sensitivity to touch is the peculiar symptom. Apis mellifica can be taken in 30 or 200 potency. Third medicine is Bryonia, is helpful for cases where joints are red, hot and swollen. With this there is a pain in the joints. The pains are sharp, stitching pain. The pain may get worse by motion and it is better with rest. It is indicated when mostly knee and elbow joints are involved. This Bryonia can be taken in 200 potency for daily one time. The next medicine is Ledampal. Ledampal offers great help in reducing pain and swelling in the ankles. Person needing it have worsening of ankle pain from movement. They find relief if in it by cold applications. They may have ascending rheumatism where pain starts from feet joints and then ascend to joints above it in the leg. Red Ampal 30 potency can be taken for rheumatoid arthritis patients. Now let's take a look at the lifestyle modifications you need to implement if you have rheumatoid arthritis, because lifestyle modifications like exercise and diet are very important to manage your symptoms and disease activity. For people with rheumatoid arthritis, exercise can be very beneficial for relieving pain and joint stiffness, and it can be particularly helpful during a flare of rheumatoid arthritis. People with RA who exercise report that they have less pain than those who do not. Exercise can reduce painful symptoms, improve joint movements, function and flexibility, increases the range of motion and also boost your mood. People with rheumatoid arthritis should avoid strenuous exercise or any exercise that can cause pain or that can aggravate their pain. So friends, I hope you found this video helpful and informative. If you did, you can support my channel by like, share and subscribe.